Good afternoon, everyone. This is County Executive Pat Ryan. Thanks for taking some time out of your day to join us. We'll try to keep it brief. Going to talk about the COVID infection rate and the situation overall in the county with COVID, and focus heavily on both our progress with vaccinations, but also how much we have left to do, and how much more work we have before we can really reach a place of true herd immunity and start to ease a lot more of the restrictions, which I know we all desperately want to do. So we'll dive right in to the data. Looking at cases and overall metrics by the numbers, we are now at 14,633 cumulative total cases. We have tested just shy of 355,000, which is remarkable. Fortunately, 13,769 recovered. And unfortunately, we continue to see fatalities, and actually our hospitalization numbers are much higher than we'd like still, even as other numbers have come down. So since my last update, which was a week ago, we've had 5 more Ulster County residents succumb to COVID, a few of them in a very short window. So even though the total active cases are coming down, we're still losing people and having folks sick enough to be hospitalized, unfortunately. Our hospitalization numbers, as I said, you can see on the graph, are continuing to slowly tick up. We think this is sort of a lagging indicator of the overall infection situation. We're at 18 currently hospitalized, and 3 of them in ICU beds on ventilators. Looking at the active case count, some really good news to report here in terms of active case count. We had seen this number staying frustratingly high even as we came down from the peak of the second wave. We were really struggling and plateauing to get that number down. And fortunately, as you can see very clearly on this graph, in the last really 2-week period, we've finally seen that dramatic decrease in active case count to now be back down well under 1,000 now active cases, under the peak from the first wave at 610 active cases to be exact, is very, very good news. That's, I think, the combination of folks continuing to follow precautions and really starting to see the impacts of now over 50% of our residents having received at least their first vaccine. But until we get everybody vaccinated, we're still going to be struggling against this active case count number. I do want to talk just very quickly, sort of technically. We had a slight lag in updating some of these numbers of our active case count. So there was a sharp drop for about a day or two period. In reality, that decrease happened more over about a 1-week time period, and we were just kind of catching up on the back end from a data perspective. But those numbers are accurate for active case counts. What really happens is we have a large number of folks that we have to actually call live to clear with them that they're good and their symptoms are cleared. And so it just took us a little bit longer than usual to do that. But that is now done, and we should all feel good that we're at that 610 active case count number. The primary reason for that, as I always say, is that we finally started to get that new positive infection rate down. And for the first time in many months, actually, our 96-hour average is below 3%. We're at 2.97%, just below, but we'll take it. So in the last 96 hours, we've tested 4,842 and had 144 new positives. So you can see on this graph that daily average, that orange line, how many new positives we're getting each day is finally starting to come down. In the last few days, we've had 38, 36, 40, 30. Which is thankfully much, much lower than it had been for quite a while. So if we can keep that number down and ramp up our vaccinations, then we're really getting to the point where we can finally see some sense of return to normalcy as we come deeper into the spring and into the summer. Hospital capacity, though, and hospital numbers are still concerning. As I said, we know it's a lagging indicator, but there are still 18 folks in Ulster County hospital beds right now with COVID, 3 of them very, very sick, all of them sick enough that they need to be hospitalized. So as we each do our part to lower the numbers and slow the spread, please also just take a minute to think about those folks and send love to them and to their families. It's extremely serious that we still have that many folks that sick. And the decisions that each of us make, we know, because we're all in this together and interconnected, could really impact more vulnerable folks in our community. So please continue to keep that in mind and not lose sight of that in the midst of what I know has been a really long year plus now of challenges. On that note, as always, have to continue to say this, and I'll continue to say this until we're through this. We need to continue to wear masks, maintain distance, and wash hands. And avoid gatherings. The one new caveat here, which just broke from the CDC, this is not binding guidance and hasn't necessarily been validated by New York State, but very encouraging new guidance from the CDC earlier today about lifting some of the mask restrictions for those that are vaccinated. So a lot of folks have been asking, hey, I've been vaccinated, but why do I still have to wear this mask? Part of the main reason why is, although we know the vaccine protects those who have been vaccinated from getting COVID, we're still uncertain, and the data was unclear about whether they could still possibly carry it or transmit it to others who haven't been vaccinated. So as we get more and more confident about that, the CDC will start to ease those restrictions. And so there are several new pieces, but probably the biggest news, and we'll talk more about it Thursday, but the quick takeaway is, for those that have been vaccinated, if you're outdoors now and in small groups outdoors and you've been vaccinated, you don't need to wear a mask anymore per the CDC guidelines. I imagine New York State will probably emulate that and pass that on shortly, but they have not done that yet. So it's an encouraging sign that as the vaccines work and as more people are vaccinated, there is a light at the end of the tunnel to ease some of these restrictions that we've all been having to deal with for the last year plus. I do want to shift gears and talk for just a minute about where we're at with vaccines and our vaccination progress. We're finally starting to see the caseloads and the active numbers come down, which is very encouraging, but I want to be clear that we are very far still from herd immunity when it comes to vaccinations. And as the vaccination rate in the county has started to slow, and I'll talk a little bit about that, I'm going to probably become increasingly vocal about the fact that we really need everyone who can safely do so, which is the 99% of people. We need folks to get vaccinated, not just for themselves, but really for everyone in the community, especially the more vulnerable folks among us that we've all been working to protect for the last year plus. We've asked a lot of people with all these other restrictions, starting with masks and business shutdowns and school closings and all the other challenges, and we've all put in so much work. And the last step to really get us over the line and back to a sense of normalcy and reopening things really is to get to herd immunity with the vaccines, and to do so fast enough, by the way, that variants don't spread and potentially put everyone at risk with a more contagious or even a more deadly variant. We're really in a race to get people vaccinated faster than the virus can mutate and sort of outmaneuver us. So that means everybody has to step up and do their part. And to me, I take the concept of sort of duty and responsibility, especially with my former military hat on, very seriously. And I think it's everybody's duty and responsibility as citizens and residents who care about their neighbors to get vaccinated, even though I know it's sort of an ask that not everybody is fully comfortable with. As the data comes in and it's clear that the risks are very, very low, and that throughout this process, all the medical experts will continue to look at those and monitor those. It's just absolutely critical that we get to that 80%. And right now, we're just over 50%, which means we have about 60,000 more people that need to be vaccinated. So we have a lot more work to do in Ulster County and across the state and the country. And we need everybody to do their part. I'll stop there for now on that part, but you're gonna continue to hear me say that more and more vocally as we have to get the last set of folks vaccinated. To that end, for the very first time, we've actually had to start reducing our request for vaccines because the supply now here and across the country is exceeding the demand. And that is a very different dynamic from where we were even a month ago, and definitely 2 or 3 months ago, where we knew, and I said, demand was way ahead of supply. So as supply has caught up, we've vaccinated over 90,000 folks in Ulster County, which is great. But now we're actually starting to have to reduce our requests, which is not a good sign, because that means we're slowing down our vaccination pace, which means it's just going to take us longer to get to that herd immunity. So we really need folks, again, to step up and make sure that we're getting everybody vaccinated as quickly as possible. So for this week, Ulster County, our health department, has been allocated 2,170 doses. That's down from a little over 3,000 last week. I don't have the wider county-wide numbers yet. I'll probably get them later today, and we'll update you all as soon as we get them. But that is an indicator that we have seen demand go down. The last thing we want to do is have too much supply and not be able to use it, so we've had to reduce our requests a little bit based on that demand. So please spread the word and let folks know that this is happening, and we need everyone to do their part. We're trying to make that as easy as possible, as sort of frictionless and painless as possible. So for the last few days, and including this week, we've been doing more walk-in clinics, going to town halls all throughout the county. Yesterday, I visited one in New Paltz, thanks to Supervisor Neil Batez and his team for hosting there in town of New Paltz. Today, I was with Supervisor Walsh and the team in Rosendale. So we are having people steadily come in to those sites. Tomorrow, we'll be at the Harold Lipton Community Center in the town of Rochester, and thanks to Supervisor Baden and his team there. And then Thursday, we'll be in Gardner, my hometown, at the Gardner Town Hall, thanks to Supervisor Majestic and the team in Gardner. We are all working to make this as easy as possible with your town and village and city leaders to host these walk-in clinics. There's no appointment required. We'll be distributing the Moderna vaccine at all of these clinics. We are seeing people come in, but at a slower rate than we would like and a slower rate than we need. So please spread the word about these walk-in clinics. Additionally, I'll reiterate that if folks are that you know or are your relatives that need that are homebound, we have gone through our initial list of folks that have requested that homebound, but I'm sure there are more out there. So please reach out if you know folks in that situation that we haven't gotten to yet, and we're working with all the town and city leaders to do that. And then I'll talk more about our transit and other pieces there, but we're still offering free bus rides and door-to-door service for seniors and those with disabilities. So that is an option that's out there. Again, we want to make it as simple, and of course, it's completely free, no cost to be able to get vaccinated and to get there to be vaccinated. Vaccination progress by the numbers in the county, we are seeing it continue to go up. We are now at over 91,000 folks that have received at least their first dose, almost 66,000 that have received their complete vaccine series, and that puts us at 51.1% of the population with at least one dose. But as a sobering reminder of how much more work, as I said, that leaves about another 60,000 adults over the age of 16 who we still need to vaccinate. So that's going to take many more weeks of work before that would get us to 100%. But even to get to the 80%, that's tens of thousands more folks that we need to get vaccinated. So if you've done your part and been vaccinated, thank you. That is great. Now please think of those in your life that need to do the same, and encourage them and maybe urge them strongly to do their part as well. For folks that have any questions or are concerned or want a resource to answer questions from others, we continue to have a really good section on our Vaccinate Ulster webpage with frequently asked questions about the health implications, how to answer those frequently asked questions that folks might have about, is this safe? What if I have this condition, or so on and so forth. We have a lot of that information right up on our website. That's vaccinateulster.com. under the frequently asked questions section. And that'll help inform both you and others that might need that information. You can also sign up for appointments there. We are still making appointments in addition to our walk-in. I mentioned this earlier, but our UCAT countywide transit service is continuing to offer free rides for folks getting vaccinated and can do door-to-door, curb-to-curb service with 24 hours notice for seniors and those with disabilities if you call ahead to UCAT at that number. Finally, folks are continuing to volunteer, and we thank them. I thank you. We'll still need more folks as we do this work over the next weeks and months, so please sign up at ulstercountyny.gov/volunteer. I'd like to thank, as always, all of our team working at our vaccine pods, volunteers, and staff. I'd like to thank all of our frontline workers doing their part to keep us safe. I want to thank Radio Kingston team for helping us continue to get this important information out, and also thank each of you for watching and being engaged and hopefully spreading the word about the work that we still have ahead. I know that we can do this. We've gone through so much over the last year, and I know it's been extremely challenging in many ways that we can't even that I can't even anyway fully express in words. But we have one more challenge to meet, and it really would be a huge shame, I think, to have made it this far through so much and so many challenges and not just make this final push to get everybody vaccinated so we can really stamp out COVID and move on with our lives and school and work and everything else. So please encourage folks to do that again. Anything you need between now and our next update or at any time, you can call our Ulster County Recovery Service Center. That number is 845-443-8888, or go to our webpage there on the screen. Our next update will be Thursday afternoon at 3 o'clock. And as always, we're standing by for any other things you need. Or creative ideas on how to get more folks vaccinated. If you know of a group that needs vaccines or any individuals, please do reach out or have them reach out. With that, we'll end it. Please stay safe and healthy and stay resilient. We're going to get through this. Just a little more work to do, and we will see you on Thursday. Thanks.